Now I want to pass the microphone to Rear Admiral and Dr. Betsy Thompson, who is Director of the Division of Heart Disease and Stroke Prevention at CDC, where they are sharpening their focus, and I know blood pressure is among your priorities, Dr. Thompson, so please fill us in.
Thank you, John. Yeah, it's not just among, it is our top priority. I want to thank the National Forum, too, for organizing this webinar and celebrating World Hypertension Day. I also wanted to echo our support of the theme for World Hypertension Day of knowing your numbers and the goal of increasing high blood pressure awareness in all populations around the world, which ties directly to our work at CDC. You know, it has been alluded to, 1 in 3 U.S. adults, that's over 78 million people, has stage 2 hypertension. And unfortunately, as the folks from Brigham and Women's stated, more than half of these people don't have their blood pressure under control. In fact, about 13 million of them aren't even aware they have high blood pressure, much less have it under control. And this is using stage 2, 140/90 as the benchmark. And uncontrolled hypertension is the leading cause of heart disease and stroke, which in turn are the leading causes of death in the country. So that's why hypertension is indeed our number one priority. Unfortunately, rates of hypertension control have been really stagnant for a number of years now at that about 48% control. And even more alarming is some of the outcomes related to hypertension the declines in mortality, for example, have either stalled, and in some cases they're even worsening. For example, among younger adults, 35 to 64-year-olds, deaths due to cardiovascular disease are actually on the rise for the first time in 4 decades. So our goal at CDC is to increase the proportion of individuals with controlled hypertension nationally to at least 70% by 2022. And this is an ambitious target when you're talking about the entire nation, no doubt, but we do believe it's attainable. Several of our speakers today have demonstrated that. At the core of our work, we have several programs that bring together state and local public health agencies, as well as health systems, clinicians, and community organizations to do this type of work. We actually put out about $100 million to heart disease and stroke prevention activities with a primary focus on hypertension to all 50 states, the District of Columbia, 12 tribes, as well as 23 tribal serving organizations, 5 cities and counties, and 2 groups of city and county health departments. In addition to that programmatic work, you're all familiar, I think, with our Million Hearts initiative that enhances all of these programs that we have and also seeks to prevent 1 million heart attacks and strokes within 5 years by 2022. And we're doing that by focusing on a small set of priorities that are selected exactly for their ability to really impact and reduce heart disease, stroke, and related conditions, most notably hypertension. I'm therefore very happy to be presenting after the Surgeon General's interview of one of our 2018 Million Hearts hypertension control champions from Tennessee. At this point, we have champions from 35 states that have served 15 million patients, 5 million of whom have hypertension. But we're doing other work too. CDC is engaging partners currently with a real focus on employers and insurers and others in the private sector to help develop national actions for hypertension control going beyond what we've traditionally done and asking for specific and actionable commitments from each of the participating partner organizations. These types of commitments, coupled with our existing federal, state, and local resources and programs, will help us move the needle and reach that goal of increasing the proportion of individuals with controlled hypertension to 70%. Before I end, I do want to just give a nod to the fact that May is Women's Health Month, so the division has been shining a light on cardiovascular disease in women and promoting messages and resources to help women know, talk, and act to prevent heart attack and stroke and stay healthy at every age. The Know, Talk, and Act refer to know your risk for heart disease and stroke. Talk to your family about the history of heart disease and stroke in your family and to your healthcare team about how to manage your risk. And 3, act early to establish and sustain heart-healthy habits that can lower the risk of heart disease and stroke. 1 in 3 women has high blood pressure, and nearly half do not have it under control, even though, as I've said, high blood pressure is a leading risk factor for stroke, heart disease, and heart attack. In closing, I don't want to end on a down note. It will take focused and collaborative efforts to improve hypertension control rates nationwide, and we look forward to continuing our work in this field. We can do this, as our speakers today have demonstrated, and I want to thank all of you for what you're doing currently and will be doing in the future to help us increase hypertension awareness, prevention, and control. Thanks. John, I'll turn it back over to you for Q&A.
Dr. Thompson, thank you very much. That was very informative, and we certainly understand why the division is so focused on hypertension control. It's the silent killer, and it's an enormous challenge that we face, as well as an enormous opportunity for improving the health of large numbers of people. So thank you for your work and for your leadership.